my name is Machela.
And my name is Jed.
Welcome to this episode of BomaChats. Today we are joined by Dr. Vuyane Mhlomi in the BoMA. He's a medical doctor and the co-founder and CEO of Quro Medical, a health tech startup in South Africa.
Great.
Really excited to hear from him.
Vuyane, thank you for joining us. Tell us a little bit.
Thank you for having me.
Tell us a little bit about what it is you're doing with Quro Medical and how you found yourself working on the problems that it's trying to solve.
Yes, so Quro Medical is a South African digital health company that has that has set itself a very audacious goal to transform healthcare across the globe.
Wow.
Because the challenges that I think we're facing are not unique to South Africa, and we leverage technology, combining that with harnessing the best of our people to improving the well-being of others. And how we are doing this is through a technology-enabled hospital at home solution that leverages remote patient monitoring to provide real-time monitoring of patients, combining that with an on-demand provision of healthcare services in the homes that allows us to shift healthcare that would traditionally be managed in a hospital and have those patients treated at home. But we've extended that value to leveraging our tech to support nursing staff in busy hospitals to provide real-time monitoring of patients in general wards. The quality of monitoring that would ordinarily take place in high care and ICU, we've made this cost-effective, simple to use, to alleviate the pressure of nursing staff and shifting the work, into so that they can focus on value-creating activities. And really, the fundamental premise for us is, how do we center care around patients? So a patient-centric model. How do you realign incentives to make sure that all the various stakeholders that create value in the healthcare ecosystem are duly rewarded? So we've innovated through a very innovative economic model. We've introduced efficiency within healthcare provision, given the limited healthcare work resources. We said, how do we do more with less in a way that is safe and actually results in clinical outcomes? In short, through Quro, we are fixing the country and by extension, the globe.
Wow, that sounds like an audacious, big, hairy goal. Thank you for sharing that.
Yeah, very exciting.
Absolutely, thank you.
Tell us a little bit about how you found yourself solving this problem and why you're passionate about it. Why are you doing it?
I guess, it's very difficult to talk about the Quro Medical story without talking about where I come from, right? In many ways, when we talk about the Facebooks of the world and the Amazons of the world and all the other players, it's often shaped and informed by context, right? And which is why, when you look at African, entrepreneurs, the problems we're trying to solve are things that, involve life. It's kind of that are necessary for basic existence, right? And so I grew up in a very impoverished community in the outskirts of Cape Town called Khayelitsha. My parents were quite sickly. My mom had complex cardiac disease. My dad had, diabetes, which was poorly controlled. And my dad died when I was 11 because our healthcare system couldn't save him. And yet the same healthcare system that couldn't save my dad, when my mom had a stroke, when I was, 16, 17, on the eve of my my final high school examinations, school leaving examinations, she was able to get into the public healthcare system, get life-saving, care, and that saved her, right? And that to me was the first experience of a healthcare system that if we were to get it right, firstly, there'll be fewer people who are in my position, losing parents at a young age, but also, people would have much better livelihoods. Therefore, I was committed to improving, the healthcare system more generally. I thought the most impactful way to do that at the time was becoming a doctor, because we often waited at clinics for very, very long time, long waiting periods. And this is not the fault of doctors. We just didn't have enough back then. We don't have enough now. And so I thought the quickest way to solve this problem as an entrepreneur is become one, right? And I went in and I studied medicine, and fast forward, I'm practicing, I'm sitting in a hypertension clinic in one of the biggest and busiest hospitals in Soweto, Johannesburg. And my patients are coming in with these scary blood pressures, really, really high. And when you engage them with their stories, they like, medication wasn't delivered, or I didn't have food, so I didn't take my medication. And I was like, well, these are clearly social problems I will not be able to solve in my lifetime. What if there's a gene that we could switch off that would potentially prevent us from ever having to deal with this issue? And there was some interesting work that was coming out of Oxford at the time that showed that it looked like, hypertension and all these disease of lifestyles, we were primed in pregnancy. And so if you compared the offspring of patients who are born to patients who have this condition called preeclampsia during pregnancy, they tend to have higher blood pressures and, diabetes, later on in life, compared to those that didn't. I was like, well, that's it. Let me go to Oxford, do a PhD, do some research in this area, and hopefully I can switch off this gene if I can find it. And so I found myself going into, I was awarded a scholarship, went to Oxford, and I was clear. I was going to do this research and I was going to switch off this gene. And that went by very quickly. But what was great for me was that I got pulled out of, the kind of the rat race of clinical medicine, and I got time to think. And when I started to look at my life and how I wanted to impact, the world of South Africa, I realized that, there's an urgency to this problem, and in our ability to address this, right? And so publishing in journals where only 5 people who are interested in this, very narrow focused work is not going to work. It's not going to help me solve this problem in time. And it was at this point, having been involved in different ventures, that I was like, we're facing a hospitalization problem, and we might just be in a unique position to solve it. And I think that's how we then started. Myself and a couple of colleagues came together. We were trying to solve this problem for the UK at the time, because there were patients who were not being discharged early enough out of fear of them not being able to be monitored while they were at home. So we then started packaging that. Fortunately, South Africa was facing a similar problem, and it was easier to start that here, and the rest is history.
That's an incredible story, Vuyane. But I'm just wondering, though, if there's a tension between the medical world that you were seeped in up until the point where you became a medical doctor, and then now you're entering this entrepreneurial space, which has a little bit of a different mantra to practicing medicine. I mean, on the one hand, people that are doctors, they need to be conservative in their approach of care. They need to be overly cautious regarding, their diagnoses. And then the Silicon Valley mantra is one in which you're moving fast and breaking things, and you're not necessarily following the rules. And it's all about, the now and the urgency. And so both of those things have inherent conflicts. And so how do you find yourself reconciling those two worlds that you occupy? Because obviously you are a man that's in a rush. So how do you? But
it's quite interesting. I don't necessarily think that I'm a rush. I think I think my pace is set by these time-sensitive issues.
Yeah.
The longer it takes for us to move means that we miss out on an opportunity to potentially save a life. For me, it's that simple, right? And coming back to the tension, I don't think it exists, at least not for me. Because even if I was going to practice traditional medicine, I would have been a clinician scientist, right? I was practicing science. I was always in the lab. I was looking for new things, right? And so even within medicine, I was always balancing the conservativeness with looking for, I never settled for the status quo, right? It isn't enough. The fact that we haven't developed, until most recently, new antibiotic new antibiotics makes absolutely no sense to me. You know what I mean? Like we've barely peaked, within healthcare, right? If we look at the evolution of healthcare, right? Innovation does not sustain itself, right? It requires consistent effort, and we do this thing in the healthcare where, we're driven by these waves, right? And there was this amazing, antibiotic era, and and we were here, and then once that left, like no one follows that because we're now looking at vaccines, and that's the hardest thing. And the next is wearables and the digital stuff, there was always that, I guess, interest in trying out new things. And so naturally, I would have landed up doing clinical trials, trying out new medication, pushing the boundaries, which I think is not different to what I'm doing right now. In fact, in many ways, my approach to entrepreneurship, I rely on the lessons that I learned from my PhD more than the lessons that I learned in my MBA, to be honest.
Wow.
It sounds like actually it's a great way to do entrepreneurship, and that inherent dissatisfaction with the status quo, that need to innovate, deliver something better for customers is really the drive. And here it's for patients. So it's a great way to have that tension being balanced, and also could be delicate in many ways, but exciting to see how you're doing it. And on that, can you tell us a little bit about how your business works and your strategy?
Absolutely. But before that, I think there's an important, caveat to the statement, because I think the Silicon Valley approach is very much move fast and break things. Here we're moving fast, but cautiously, right? Because there are lives, there are patients' lives that are involved. But I guess the principles here are the same.
Yeah.
And that there's of course this race against time and lives. How our business works is so our initial focus is where we're trying to address this issue of hospitalization, right? And that when patients are often unwell, they land up in hospitals, right? And once they're in there, you're often in different sort of stages within, or different levels of care within the hospital. You could either be in the general ward. Usually you're sitting there, no close monitoring. You've got someone coming in, taking your vital signs every 4 to 6 hours, if at all. And at times you're at the mercy of, the cleaner to pick up if something happens to you, before you get actually picked up by the nurses, because they're just run off their feet and they're busy with other patients. And of course, the other levels are high care, where you're a lot more closely monitored. The ratio of nursing to patient is a lot better. And of course, it improves as you step a level higher. Now, the reason we treat patients in general wards is because we wanted to kind of concentrate healthcare services. Once you're in here, you can have access to a CT scan, your blood's drawn, etc. But you get access to oxygen and your antibiotics and whatever medication you want. But apart from that, it makes no sense for you to be in hospital, right? And so, if you can move some of these services or deliver these services at home, technically, there's no need for you to be in the hospital, particularly when the risk of you being in hospital is where the risk of contracting a potentially fatal infection while you are there trying to access oxygen outweighs the services that frankly could be rendered elsewhere. And that's what we're trying to do. So we then looked at all these essential elements of care, where you've got doctor oversight, where you've got clinical services that are provided in the hospital. So whether that's oxygen or laboratory tests or physiotherapy, all these things that you need. We then bundled these into a comprehensive basket of services, and we arranged to have those delivered to the patient at home. Therefore, the only thing that's missing is around monitoring. Now, the current quality of monitoring is that you've got this ad hoc or infrequent monitoring of patients through vital signs in the hospital. We then introduce a solution where you can actually monitor patients minute by minute and in real time, leveraging technology, which is a wearable chest biosensor, FDA approved, CE marked, registered with the South African Health Products Regulatory Authority. And what this does is that it now, for the first time, unblinds the doctor to what is happening to the patient at home, right? We've now got all these services, and we've built an additional safety net of capturing vital signs in real time. And I'm talking about the entire spectrum, heart rate, respiratory rate, temperature, ECG, which is that little wavy thing you see in hospitals, right?
Yeah.
We know when our patients are lying down, standing up. We've got fall detection capabilities. So if a patient falls while they are taking a bath or in the shower, by the way, this is much better than what you'll get in a lot of the hospitals, right? We then are able to get this in real time. But beyond this, right, because at the moment, the design is that, you pick up when this thing happens. We actually had released the second of our algorithms whose role is to anticipate these things, right? So building early warning system capabilities where if a patient is about to experience an event, we can then mobilize the necessary intervention. So there are heart attacks that we've been able to anticipate where based on our early warning systems, we've been able to pick up that this person is going to have an imminent heart attack. We then dispatch our team that then intervene in the home. And 6 hours later, a patient complains of chest pain, right? And we're doing this thing here, right, in SA. But this challenge is not unique to South Africa. So firstly, we've gotten the essential elements of in-hospital care to the patient's home. Next is the safety net, which is real-time monitoring with early warning system capability. The third part is responses. So the idea is that we're not just collecting data for collecting data's sake. It's tied into an ecosystem where the collection of these real-time vital sign data is actually transmitted to a 24-hour command center that is run by doctors and nurses, etc. Okay? We're headquartered in Johannesburg, South Africa, and we've got patients across the country, right? And so when this information comes through, we're able to pick up, and then we've got a network of emergency medical services providers that are able to respond much faster than sometimes the response you'll get in the traditional hospital setting. So we promote visibility over proximity. So the relative safety that you get from the proximity of being in an in-hospital facility, you now get the real value of knowing that someone is actually watching you, right? And then what we've then done is that, we've got the services, etc. We've built a proprietary platform that doctors, no matter where they are, can actually log on to the platform and see how their patients are doing in real time. So now, instead of doctors having limited capacity and having 5 beds in hospital, they can have these patients that are in hospital that need to be there. And they've got these other 30 patients that they can actually monitor who are in homes, etc., where we've got a dedicated team of people that actually delivers care to them in the patient's home. The good thing is that we built and created a system here where it is centered around the patient, right? Firstly, the dynamic shifts. When you're in the hospital, patients and their families are a nuisance to doctors, but now the power dynamic has shifted towards the home, right? Where patients invite us to be there. We deliver care in an environment that is safe and secure. And what that does actually is that it results in faster recovery times, better satisfaction with care, fewer readmission rates. And then when you compare the cost of providing that service, right, to the cost of delivering care in the hospital facility, there's a significant cost saving because the average day in a hospital bed, even within the NHS, costs more than a queen bedroom at the Ritz Hotel in London, right? And so you've got a situation here where you've got a good solution, patient-centered, in the patient's home, that's cost-effective with better clinical outcomes compared to the status quo where it's nothing like that. So that's what the service looks like.
And Vuyane, you describe a global vision where this is a problem right now that you're solving specifically in South Africa, but you would like to apply the learnings and the possibilities that the technology presents around the world. Tell us a little bit about what that vision of success looks like for you and where you would like to see Quro Medical in 5 years, 10 years, 20 years time. What will make you really happy when you're retired on your rocking chair and you're reflecting back on your life? What would you like to be part of that reflection?
I think there's a personal, aspiration and vision and goal. And then there's like kind of an organizational one. I think the personal one for me is that one of the things that used to frustrate me about practicing medicine in South Africa is that you were not really practicing medicine. You know what I mean? You were plugging holes. You were, patient care was only at one part, but half the time you're dealing with crises that frankly had nothing to do with healthcare, right? Hence we talk about the social determinants of health, right? To give you a simple example that I mentioned in the hospital, there was a time when a patient the hospital ran out of bread, right, as a meal for patients, right? And with my intern salary, I was like, I am going to take this money and I'm going to buy bread because I will not be treating patients who are on insulin, who desperately need the medication while they are sitting there starved. You know what I mean? And so you're fighting for hospital bed and capacity, right? And in my world, if you think about it, patients already have a roof above their heads. That's one less thing to think about, right? You go into their homes, you start to have an appreciation of all the other social determinants of health, which means it gives you an opportunity to intervene, right? But to bring them into these semi-sterile environments, to give them a quick fix and then back into the state, it doesn't fix anything. And so for me, the future of healthcare is one in which, healthcare meets patients where they are, right? Both in the wellness phase of their lives, as a way of trying to prevent them from, entering the healthcare system. When they need acute care, healthcare still meets them where they are through the delivery of those services at home, and only when necessary, where the home is no longer a fit place to treat that patient. So I need to operate. I need, dedicated level 1 facilities. I need ICU facilities. Only at that point do we treat these patients, in these facilities, and then very quickly transition them back into the environment that they need to be. I think that's when I know that I would have arrived. And what that will do is that we'll spend, we'll take that 400 million that we often spend building these ridiculous hospitals, actually investing in creating these environments that allows us to actually live primarily, but also being able to look after us when we're not doing well. So my personal one is to practice medicine the way it's supposed to, and I think this is the way in which it is supposed to be practiced. And it doesn't matter where you are, right? Here there are no borders, and this is the thing about healthcare, and COVID taught us very much about that.
Definitely a compelling vision, and one that we'd be very excited to see come to fruition. When you think about the biggest barriers to us getting there, what's the biggest blocker towards us actually achieving that vision, which is really a compelling one?
And I think they are vested interest in maintaining the status quo.
Yeah.
I think. Look, don't get me wrong. I don't think that healthcare is free. I don't think healthcare can be free. I think someone is paying for it. I think we've got different models are paying for it, but healthcare and what is required, someone is paying for it, right? And I think there are ways in which you can solve for it in a way that is healthy and sustainable. And I think at the moment, it isn't, right? We are a purpose-driven organization, but we are a for-profit organization. And our profits are also designed to ensure a sustainable model of healthcare delivery. Otherwise, this thing won't last, right? And so I think there are vested interest in the healthcare space to prevent that shift. I think there are areas, I think there are just certain industries where pursuits are often noble. The building of hospitals shouldn't be driven by profits, right? It should be primarily about delivering care. And you need to understand what is that, when is that enough? And when do we know we've actually delivered on this before moving on to the next thing? But the idea of having, 5 different hospitals within a 30-kilometer radius, and then have this kind of supply-induced demand is not an effective way of dealing with them. I think the people who are often in healthcare right now are the biggest barriers, because we've got these massive assets in these ridiculous buildings that we need to, sustain.
Yeah.
And as a result, we are not going to shift from embracing these alternative models because of these massive investments, right? And frankly, I think that then filters out through everywhere we do our business, right? Who will not be in the regulatory space, who our politicians support and which legislations they advance. I think but it's largely driven by the interests of those and what people are trying to and the interests that people are trying to protect. And so, in many ways, we are our own bottleneck.
Gotcha. Yeah, it reminds me of to change industries a bit. The same debate occurs with like the private prison industry in the U.S. and how they're the chief lobbyists to try to change criminal codes to increase the number of people that actually go to prison. So you have these perverse incentives there rather than
Absolutely.
focusing on rehabilitation and helping people overcome things like addiction. Let's rather lock them up, and to just to feed the profits of some private organization. But Michelle and I also often talk about the education space and all of these for-profit education institutions. And we ask ourselves, like, should education be something that is trying to be profitable, or is it a public good? And how do you how do you juggle both of those aims? And healthcare is the same thing, right? It's a public good on one hand, but it's something that is costly to provide high care. And so how do you balance those two things? So
And be sustainable.
But
yeah.
absolutely, like the suggestion that my co-founder and I share this belief that the private sector needs to do more to shoulder the burden of the public sector, right? I think there's a lot of innovation and work that we can and should be doing to actually support those efforts, right? And I think we're trying to do that here. You know what I mean? And so this notion that all private sector business is evil, I don't think is the case. I think people along the way have kind of lost the kind of ethical and moral drive that got them in there. Much like many presidents, if you look across the continent, when they all started, they were motivated really, and there's something about that seat that corrupts them. Right. And there's something that they do during that period that prevents them from vacating those seats. Right. And so, people I think go in there with those very true intentions.
Yeah.
And I think a lot of the opportunities that we see that people have, and the businesses that are there, whether it's in the private healthcare space, education, etc., often it's because it's born out of a gap, right, where government isn't fulfilling, right, a very important role. But I think within that entire ecosystem, there isn't a feedback loop that then goes back to assist in how do we fix this thing in the long term, right? And so if you create a system where the private sector only thrives on the deficiencies of government, there is no incentives within the system to fix those deficiencies, right? Whereas I think there's a way in which you can create an ecosystem in which, yes, there's room for private sector. So in other words, the government creates an economic environment that allows private sector to create jobs and opportunities and solve for problems. But a measure shouldn't be about how much you created shareholder value. It should be a measure of what has been the impact on the much bigger problem, in this case, in healthcare. So each business needs to be able to account, but how have they made the public system better? And I think when you start feeding back into the fundamental challenge that created this, and because I think the private sector should be rewarded for the value that it creates, right, in fixing the system, right? But I don't think that it should be benefiting from the shortcomings of the system, because there's zero incentive to address those issues.
Yeah, you're actually hoping they get worse potentially, which is terrible.
As you said, perverse incentives, and I think a value-based approach and one where incentives are aligned, definitely
absolutely
way forward or way to solve these type of problems that are complex. Do you have any other questions, Jed?
Yeah, I've tons of questions. But so. Yeah, you mentioned how right now Quro is in South Africa, but you have global ambition. But you're right now, I'm guessing you're focused mostly on solving the issues around hospitalization and providing in-home care. You've got to focus initially. Like you can't be everywhere all at once. You can't do everything all at once. So you're focused on in South Africa right now. How do you translate all of these lessons and the model that you're going to be creating in South Africa? How do you translate that to other South African countries to Europe
Emerging markets.
to the US. What are your plans there? Because they're all. I mean, you're offering the same service, but it's going to have to be somewhat different in different places, right?
Absolutely. So as of last week, we're no longer just in South Africa. We're also in Namibia, which is very exciting for us.
Congratulations.
And no, thank you. And you're right. That the healthcare systems across the continent, for example, and emerging markets, and as you grow up north and east and west, they just change, right? They're very different, and so our approach is definitely not a plug and play. But what we are doing is building a model that makes it easier to not just penetrate those markets, but to also make sure that once we're in there and we've plugged into that within that healthcare system, that the business itself is sustainable. And in many ways, our approach is kind of moving into markets that are as similar as possible. So healthcare systems are as similar as possible to ours. So hence Namibia is very easy to, the UK, for example, becomes a very easy market to go into. I have got zero interest at the moment to go to the US. I think there are many players that are focused there. Yeah. But also I think the emerging markets are neglected, right? Mm-hmm. If you look at, if you go from, Cape Town to Cairo, there are fewer facilities as you make your way up to up the north, right? There are fewer actual hospital facilities, right? And the way in which care is delivered is actually it's delivered at home, right? And, there are community workers, doctors still go in and provide care. Imagine then, where you then come in and say, guys, you don't have to invest 500 million rands in a hospital facility. We can actually decentralize healthcare. We can actually decentralize care, leveraging this particular system. And so now we start creating a future in which you've got these kind of dedicated ICU, ER, and theaters, but everybody else is treated at home. Yeah. Right, and so you kind of leapfrog, and emerging markets are ideal for
Absolutely.
that particular market. And then, of course, there's additional complexity. The healthcare systems are different, the political systems are different, but also our ability to repatriate cash, right, it becomes an interesting concern. And those are the things that we are actively, solving for. That being said, our approach to growth is through other partnerships. We see the value of actually partnering with entities that are not just familiar with those healthcare systems, but also I think we're motivated differently as citizens of those particular countries to solve those specific problems. I think you move faster together. So that is different. So in other models, there's governmentary partnerships. Others, we are partnering directly with hospitals themselves that want to expand their services. And in other areas, we are doing direct expansion. Example here is Namibia. In other areas, we're simply licensing. The plan will be just to license the technology. So in other words, we're there, but we're taking different models. So it really sort of changes based on the need of that particular country, and without a doubt, you can't do it without partnerships.
Gotcha.
Yeah, it's so interesting, Vuyane, that you brought up partnerships, because my question was really around that. And because you just can't operate, and often some of those incumbents, you need to partner with them. And I wanted to know, how do you think about partnerships, and what are you looking for? What's like critical for you to the success of a partnership?
Values, I think, for me, is the number one determinant. If we are not aligned, if our values are not aligned, I mean, we can talk about your capabilities. We can talk about, the kind of additional abilities you bring to the offering, the strength of your dollar and your capital investment. We can look at that. But if the values are not aligned, if you are not in the mission of saving lives and improving healthcare, not just in your mission statement, but in how you carry your business, like we have no business doing business with you. You know what I mean? I think at the core of what we do, we are driven by that. And the reality is that the work we're in it's exceptionally complex.
Yeah.
it's demanding, right? And it takes everything out of you. And when we need people who are motivated by more than just the value by more than the money that they are going to make. And we've seen that and we've experienced it ourselves. Currency follows value. You go in there to create value, the cash will always follow. You know what I mean? And we've seen that. And so if you then solve for value, right, both in the partnership, and this is where there's evidence, I mean, in our due diligence, we engage the beneficiaries of those guys. Do these people do what they said they will do? Or what is your impact? You know what I mean? So it's not about what they contribute to the society, but what are they taking away as well, right? Because that's something else that people don't think about. Looking at and engaging staff that work for these organizations. The books are great that you guys have performed, but what have you had to do to keep those books clean? You know what I mean? All of those things for us are just very, very important. And as you can imagine, it's really, really hard. But this is an investment for us, of course, in the future, because this is potentially one partner we don't have to worry about, 10 years down the line, that they'll be involved in some or other, corrupt practice, which we are not in the business of.
Vuyane, we're in a world that's awash in data, and you mentioned the different ECG monitoring device and the kind of connected home that is feeding healthcare data into your regional operation centers, and there are people monitoring, key statistics, health statistics of your patients. How do you figure out what data is important and what's not important to providing care? Because we all are familiar with Tableau visualizations and Power BI visualizations, and eventually it's just so much. So how have you figured out what's critical and what needs to be monitored? And
Look, it's quite interesting. We always try and collect only that which is necessary.
Okay.
Right, to try to inform clinical decision making or the care of the patients. I think there are sometimes, the question is you complete, sometimes you're like, but why do you need this information? I get why other people collect it, but why do you need that information, right? And so for us, we collect the kind of information that is necessary to either for either the continued development of this platform, so to make it more and more intelligent, and that informs our ability to look after you, right? And therefore, what that then does is that it narrows all this data that you can collect. I mean, we could collect, how often the patient sweats. There's just so many data points. But the question for us is always, is that a necessary data point right now? And of course, there are opportunities in the future from an R&D perspective about what you could potentially do with that data, right? And so much like our approach is identifying what is core in the decision making process, and of course aligned with the longer term strategy. And we're talking about lots of data because this is coming in minute by minute. Yeah. Right. And if you can imagine, it's I almost said personalized to the core, right? And that you've got you got the patient's baseline. You see how their physiology is sitting at any given time, and then you see how their physiology changes when they've taken medication or when they've exerted themselves. You've seen how they improve over time, right? During the course of their treatment, right? We are now adding additional data to that and saying, look, if you then combine that with laboratory information, how does that data look like for that? How do you alter that course? We bring in radiology, is clinical notes. Now you've got this full view of these patients, right? We know that when your vital signs do X combined with, this particular clinical input plus laboratory information, we can actually anticipate that you're going to run into trouble, 3 days down the line. That's where we'd like to do. And again, for us, that's a value for a patient. And then what that then does for us is that how do we alter that course, which is the next phase, which is when you then introduce X intervention, is there an opportunity to completely alter this course for this patient, right? And you need specific information. I don't need to have your banking details to to know that, but there's specific physiological information that becomes necessary. And I think for patients as core contributors into this kind of exploratory exercise, we have an ethical and a moral obligation to be able to share that information with them and say, look at what your information has been able to do, right? And we always say to our patients, this is your data. You own that data, not your doctor, not us, not everybody else. You give us rights to use that data and to improve our platforms. And so we always want to go back and say, look, today your data has allowed us to improve your care in this particular way. With your permission, if you give us more, we believe we can enhance the value that we're able to create with you. And therefore, patients then are often very comfortable to share with us to be able to do more. And even come back and say, the data you've given us has been able to help us, do 1, 2, and 3 for others. And so you now are changing the value and how that data is utilized. And even from a commercial perspective, don't get me wrong, it's creating mega value for our shareholders and the value of the business. But what is driving us, and the fact that we are rooted in purpose, right, is I think a good enough motivation to help us, that guide us rather in this particular way.
Thank you.
Thanks, Vuyane. Last one from me. You've spoken a lot about that data and medical records. Given that it's the digitization, especially in Africa, is not great, how are you guys getting around that? Or are you only working in contexts where you can have digital data?
Yeah. Again, we often say this thing about like digitization in Africa is not great, and we say so kind of very loosely, right? I think there are certain areas in which, yes, that is the case, and I think that there's that I think it's there, right? I just don't think it's being harnessed. You know what I mean? A lot of this information, particularly in the healthcare space, is collected. Right.
So you're finding the pockets where the data is available and digitized and tapping into that.
Absolutely. But also where a single intervention unlocks mega opportunities, right? So in this case, by purely shifting, so by simply replacing the big mega machines from a monitoring perspective and introduce a simple wearable sensor that transmits encrypted physiological parameters through a locked device that sends information on an existing telecommunications platform securely to a cloud, changes that altogether. You know what I mean? We haven't had to build mega, facilities. But to your point, this is, I'm not in any way suggesting that, Africa is fully digitized. I think that part of the reason why many people have not moved with intention is because the lack of access to the infrastructure and the perceived limitations has actually limited the focus on the continent. You know what I mean? And I think what we're trying to solve for here is that we have made inroads in SA that they haven't made in the US, they haven't made in the UK and in Ireland. There are guys who ask us about our hospital at home model and how that can be applied in other parts of the world. There are people who are asking us about how we get around the internet challenge, how we're getting around a lot of the things that we think have been solved in other parts of the world, which we have exactly solved for. And then when you look at, what the capabilities that actually exist within the continent, the basics are there. It's really about how do you then harness those. And I think that is what we're trying to I guess that's our approach. I think there's a term that frustrates me to no end. Doing one of these submissions, the people who believe that when there's an innovation that comes from the continent, that subsequently gets applied in the West and the rest of the world, that is called reverse innovation. Like, how insulting is that? You know what I mean? How insulting is that? And if you think about it, a lot of the challenges that the global north is facing at the moment, like we've got stripes, immigration is not a new challenge to us. Wars are not anything new, right? Hunger, poverty, economic crisis. We've been dealing with issues of the climate. We know what looks like. I think the guys just need to be open to learning. I digress. The point around coming back to digitization, I don't think that it is as a big problem as I think many people make it out to be. And I think we do have the building blocks there. And I think the work that the Googles of this world are doing, the AWSs of this world are doing, and driving that MTN and all the other telcos, we're leveraging a lot of those capabilities. But I think there are other things that we are doing. To give you a simple example, in SA, there's something called TV white space. So just very quickly, TV white space, when you turn your radio and you're trying to tune into another station, it goes shh. Yeah. So basically that's called TV white space, right? And the advantage of that is that it enables long distance transmission, right? And so South Africa has that. You could be in the most rural areas and you will still have a radio connection, right? You'll still be able to get that. And there's a company that's cracked that. So now they're able to build 3G and 4G capabilities on the back of TV white space to enable long distance transmission of data. Wow. So no AWS, no Google there, right? And this is infrastructure that exists that can be leveraged, right, for this kind of capability. And that's what we need. You know what I mean? The point I'm trying to make is that it is there.
Got it. Vuyane, we're running over time, but and I hate to put you on the spot with this question, and I know it's going to be a tough one, but you're invited to the high school in Khayelitsha that you attended. You're invited to give a speech at the graduation ceremony to new graduates, 18 years old. What is the theme of your speech, and what is the message that you would want to impart with the next generation?
I would probably take an excerpt out of my valedictorian speech, that I delivered, and I think these are, for me, 5 principles that I generally live by, and I think I've been very grateful that I still live by those 5 principles, which are lessons that are learned from, pencils, right? I'm not sure if you know those lessons. Are you guys familiar with them? No.
No.
Great. So story very quickly goes that a manufacturer of a pencil company, after manufacturing all these pencils, puts them in front of them and says, before I send you out into the world, I've got 5 lessons that I want you to live by. The first one is that no matter how brilliant and well created, you cannot be effective as a pencil unless you are in the master's hand, right? As a person who's religious, this is something for me that is important. I recognize the talents that I was born with, but I also know that my maximum potential only exists and can only come by being in the master's hand. Secondly, you will go through extreme sharpening every now and then, but that is only to make you a better pencil, right? Number 3, you will notice you come in different shapes and sizes. Some of you are red and blue, some of you are thick and others, but that's not what defines you and sets you apart as a pencil. What sets you apart is the lead that's inside of you, okay? So your values, your character, that is what's important. Number 4, you will notice that I've created you with an eraser on top, right? So that as you make your way, and you will make mistakes, we don't want your mistakes to hinder your future progress. So if you need to erase, or you need to forget, and you need to learn, you've got that here. And number 5, your role as a pencil, no matter where you are, is to make a mark. Make sure it is a good one. And that would be the exit that I would use.
Okay, you rose to the challenge with that one.
Amazing. Thank you so much, Vuyane. We're really leaving this with so much wisdom, so much excitement around what's happening on the continent. So appreciate you coming through. I'm sure there are tons of people who want to follow your progress or Quro's progress. How would they do that? Are you on the socials, or how can they?
Yes, we are. Quro Medical. So Quro Medical. We're on LinkedIn, we're on Instagram, we're on Twitter. And our team tries to be active and engaging, so people can definitely follow our progress. They can also check us out on our website, quromedical.co.za. And
thank you so much, Vuyane. This is great.